Good morning, dear students. So today will discuss about the MCQs of the gastrointestinal tract. So MCQs will be asked in your internal assessment examination, and also it will be there even in your annual examination also. So it plays a very important role, and even it is a these are scoring questions. Like you can score the marks very easily in this if you properly use your mind and your brain, right? So starting with the MCQs of the GIT, the first question: the chief neurotransmitter of the enteric nervous system. We are talking about the gastrointestinal tract, enteric nervous system, is enkephalins, serotonin, acetylcholine, and vasoactive intestinal polypeptide. So I got four options here. The question is chief neurotransmitter. See, all these are neurotransmitters, and all these are also being released in the enteric nervous system. The airbags plexus, it is being released, and also in the myenteric nerve plexus also one of the hormones is being released. So the question here is chief, that is main. Okay. So here the answer for this will be the acetylcholine, right? Because this acetylcholine, so what happens is when this is being released from the parasympathetic end, it is going to increase the secretions and also increasing the motility of the GIT. So the answer here is acetylcholine. Coming to the next question, stimulation of myenteric plexus causes all of the following. So I repeat once again, it is the stimulation. When there is stimulation of the myenteric plexus, okay. So myenteric plexus, it causes all of the following. So once there is stimulation, automatically what will happen is there is increase in the secretions, and also there is an increase in the motility of the GIT. Okay. So in such case, all the things are happening except definitely increased tone of the gut wall will happen when there is stimulation of myenteric plexus, so it is ruled out. Increased contraction of pyloric sphincter, will come to this later. Increased force of contraction of the gut wall, so definitely this is also going to happen. And increased rate of contraction of the gut wall, so this is also going to happen. Our question is, what is not happening, right? All are happening except. So here the answer will be increased contraction of pyloric sphincter, because if there is increased contraction of the pyloric sphincter, what will happen is the food will remain in the stomach. Okay? The motility is affected. The food will not enter into your small intestine. So the whole purpose of stimulation of the myenteric plexus will be completely abolished. So for that reason, so here the answer is increased contraction of pyloric sphincter. Okay? So this is not going to happen when the myenteric nerve plexus is stimulated. Next question, the condition in which the lower esophageal sphincter fails to relax. So here what happens is when you during the process of deglutition, so when you swallow the food, right, and once the food enters from your mouth into your pharynx and it is passing through your esophagus, so it has the lower esophageal sphincter should relax, then only the food will enter into your stomach. Okay, so this is a normal process. But in certain conditions, what happens? Lower esophageal sphincter remains constricted. Okay, and this happens during. So you have got four options here. One is gastritis, second is achalasia cardia, esophagitis, and peptic ulcer. So gastritis, nothing but increased production of the acid in the stomach. So that has got nothing to do with this. Esophagitis is the inflammation of the esophagus. So in this condition also it's not going to happen. And then peptic ulcer. So peptic ulcer is ulcers in the stomach or ulcers in the duodenum. So that also has got nothing to do with this. So here the answer is achalasia cardia. So here achalasia cardia, here what will happen is the lower esophageal sphincter fails to relax. As a result of that, the food will accumulate in the lower part of the esophagus, and also in this condition the person will feel heartburn, right? So achalasia cardia is the answer here. Next, the factor which is inhibiting the gastric emptying. So read the question completely. Don't just, once you see the word gastric emptying, don't come in the josh and immediately mark the answer. Read the answer question completely, read the options, then only you answer the question. So here the question is the factor which is inhibiting the gastric emptying is. The options are gastric secretion, increased food volume, parasympathetic activity, and cholecystokinin secretion. Now here gastrin is secreted once the food enters inside the stomach. That facilitates the production of the gastric juice and some HCl. So as a result, this is favoring the gastric emptying, gastric secretion. And increased food volume, so this also favors the gastric emptying. Parasympathetic activity, release of acetylcholine, increases the GI motility. So that also is going to favor the gastric emptying. So the one which is remaining with us is cholecystokinin. So cholecystokinin secretion, it inhibits the gastric emptying. So what happens is when the acidic chyme enters into the first part of duodenum, right? So once when this happens, what happens is there cholecystokinin will be released, and that cholecystokinin, so that is acting on the stomach and preventing the gastric emptying. So the answer for this question is cholecystokinin secretion. The factor which is inhibiting the gastric emptying is cholecystokinin secretion. Coming to the next question, the factor, so that it is opposite. The question is opposite. See here the factor that increases the gastric emptying. So don't get confused. So here you have to choose the option which is going to increase the process of gastric emptying. The options are gastric secretion. Yes, it will increase. Cholecystokinin secretion, then secretin secretion, and fourth one is the products of digestion, right? So now here you got four options: gastrin secretion, cholecystokinin secretion, secretin secretion, and products of digestion. So here answer is the gastrin secretion. Definitely the answer is gastrin secretion. Cholecystokinin inhibits, secretin inhibits, and the products of digestion. So if it is fat or if it is proteins, again it is going to inhibit the gastric secretion. Provided if it is carbohydrates, then only the gastric emptying will be increased. So here the answer is the gastrin secretion. Next, gastrocolic reflex is caused due to accumulation of food in the colon. See here the word is gastrocolic. So stomach and colon, right? So food cannot get accumulated in colon. More active in adults than in children. It inhibits defecation reflex, and fourth one is regulated by both neural and hormonal mechanisms. So here the appropriate answer is it is regulated by both neural and hormonal mechanism. Gastrocolic reflex. Once the person eats the food, he feels he has the feeling to pass the food after that. So that is the gastrocolic reflex. So answer here is regulated by both neural and hormonal mechanisms. Next, as the salivary secretion passes through the ducts, so in the acinar cells, what happens is this salivary juice is secreted, and once it is passing through the ducts, what happens is sodium is reabsorbed, chloride is reabsorbed, and there is addition of bicarbonate. So bicarbonate is being added to the juice which is passing through the salivary ducts. So let's see what are the options. Sodium is secreted into the lumen. No, it is reabsorbed from the lumen. Potassium is reabsorbed into the ductal epithelium. No, potassium is thrown into the lumen. Chloride is actively absorbed in the ductal epithelium. So to some extent this is happening. Bicarbonate is secreted into the lumen. So the more favoring thing, the major thing which is happening when the salivary juice is passing through the ducts is addition of bicarbonate. So the appropriate answer here is bicarbonate is secreted into the lumen. Next question. Chief cells of stomach secrete. Let's see the options. Hydrochloric acid, mucus, pepsinogen, and intrinsic factor. This is a very straightforward question if you know the histology and if you know the proper anatomy of the stomach. HCl secreted by the parietal cells, mucus goblet cells. Intrinsic factor Again, it is secreted by parotid cells. So the option which is remaining is pepsinogen. So you can aram se tick this answer, pepsinogen. Okay. Next, coming to the next question. Parietal cells of the stomach secrete. Just now I discussed, so this answer should be very easy for you people. First option is hydrochloric acid. Second is intrinsic factor. Third is both intrinsic factor and hydrochloric acid. And fourth one is secretin. So the easy option for you. Here, once you see the parietal cells of the stomach question, don't get excited and write immediately tick the HCl option. Please see the other options also. Okay. You may lose a mark here by ticking only HCl because other option is also there. That is both HCl and intrinsic factor. So be very careful with this when this question is being asked. This kind of questions are being asked. That's why read all the options before ticking the answer. Right. So here the answer is hydrochloric acid and intrinsic factor. Both of these. So coming to the next question. Intrinsic factor is required for the absorption of. Let me tell you. Here the complete name of intrinsic factor is intrinsic factor of Castle. So once there is intrinsic factor of Castle, there should be an extrinsic factor of Castle also. So extrinsic factor of Castle, it is another name of vitamin B12, right? So got the options here: vitamin C, vitamin A, vitamin B1 and vitamin B12. So I hope it is easy for you to choose from here. So intrinsic factor of Castle is required for the absorption of extrinsic factor of Castle, and extrinsic factor of Castle, the other name of this is vitamin B12. So easily you can choose the option that is vitamin B12. Going to the next question. Cephalic phase. Okay. Cephalic phase of gastric secretion. So it is purely related to your brain, right? So gastric secretion, not necessary that only when the food enters into your stomach the gastric secretion is happening. Only when the food enters into your intestine there is something happening with the gastric secretion. No, even without the food entering into your stomach, just by the thought of the food, by the sight of the food, by the smell of the food or the food in your mouth, there can be secretion of gastric juice. So this is the cephalic phase of gastric secretion. Let's see what are the options given here. It occurs before the food enters the stomach. Definitely this option is right there, but let's see other options also. It accounts for 20% of gastric secretion. So this is also right. It occurs due to the sight, smell and the thought of the food. Definitely all of the above. Okay, so you got four options here, and fourth option is covering all the remaining three options. That is, it occurs before the food enters the stomach, accounts for 20% of gastric secretion and occurs due to sight, smell and thought of food. So all these three are there in the cephalic phase of gastric secretion. So the option covering all these three is the fourth option, that is all of the above. So you have to choose, aram se here, go for the fourth option or D option, that is cephalic phase of gastric secretion. This one, all of the above, all of the above. Next, coming to the next question, the hormone which is responsible for the gastric phase of the gastric secretion is number 1 gastrin, number 2 cholecystokinin pancreasamine, number 3 secretin and number 4 vasoactive intestinal polypeptide. So here gastrin is the hormone, okay, which is required or which is favoring this gastric juice secretion. So option is gastrin. Next question is sham feeding. So this is one of the favorite questions as far as theory exam is concerned, Viva is concerned. Okay, so sham feeding, also called as false feeding. So this experiment was done on a dog. So here the dog was fed the food and there is a hole made in the neck. So the food was entering his mouth. The dog was getting the satisfaction of eating the food, but the food was not entering inside the stomach. Okay, so it was coming out through the hole present in the neck. So here what happens is this was done, and at the same time during this experiment there was Pavlov's pouch made, and the secretions of the stomach, they were collected during this process. And interestingly, what happened when the dog was made to eat the food, and without the food entering into the stomach, the food was falling through the neck, like was falling outside, and at the same time juice was being produced inside the stomach of the dog. So this was done, this sham feeding experiment was done to prove the cephalic phase of gastric juice secretion. So this was the base behind this sham feeding experiment. Let's see what are the options we are having here. So the first one is, it proves cephalic phase of gastric secretion, gastric phase of gastric secretion, intestinal phase of gastric secretion, interdigestive phase of gastric secretion. So if you know what is this sham feeding experiment, and just now I discussed about that, about this sham feeding experiment, here the food is not at all entering into the stomach. So gastric phase, intestinal phase, interdigestive phase are all ruled out. The one which is remaining is the cephalic phase of gastric secretion. This was purely for the cephalic phase of gastric juice secretion. So sham feeding experiment proves the cephalic phase of gastric juice secretion. Answer is A. Next, 14th question. The statement which is true regarding prehepatic jaundice. See, jaundice, as you all know, yellowish discoloration of the skin and the mucous membrane due to increase in the serum bilirubin level more than 1 milligram percentage is called as jaundice. Sorry, more than 2 milligram percentage is called as jaundice, and it is classified into 3 groups: prehepatic, hepatic, and posthepatic. So prehepatic, okay, whatever is happening before the kidney, before the liver. So here normally what happens, RBCs are destroyed after 120 days, and as a result the hemoglobin is released, and the hemoglobin is finally it is broken down, and the bilirubin is released, and this bilirubin, it is an unconjugated bilirubin, right? So this unconjugated bilirubin, it binds with the transport protein albumin, and it is brought to the liver, and in the hepatocytes it is conjugated, right? So this is all the process which is happening, and once it is conjugated, it is released. It is released into the bile, and that again goes into the second part of the duodenum, and the further things are happening. Now here we are talking about prehepatic jaundice. Let's see what are the options. It is caused due to toxic damage to the liver. See, here we are talking about prehepatic, so before the liver, so nothing to do with the liver. So this option is ruled out. There is increased concentration of unconjugated bilirubin in the blood. There is a decreased excretion of stercobilinogen. Urobilinogen is absent in the liver. So things related to the liver, you please remove all the options. So you have the best option here is, there is increased concentration of unconjugated bilirubin in the blood. So here what happens is, more amount of unconjugated bilirubin is being produced. More amount of bilirubin is produced because of damage or because of hemolysis. So more amount of unconjugated bilirubin is present. So as a result of that, the option which can be selected here safely is, there is increase in the concentration of unconjugated bilirubin in the blood. So more than the capacity, whatever the liver's capacity is there to conjugate, so more than that the bilirubin is being produced. So as a result, more amount of unconjugated bilirubin will be present in the blood. So here the option, safe option is the B one. Next, coming to the 15th question. Excessive breakdown of RBCs leads to. So it is a straightforward question. Without the option you can answer here. It causes prehepatic jaundice. So prehepatic, hepatic, posthepatic, and none of the above. So here blindly, easily you can select the option, that is prehepatic jaundice. Next question. Stones in the gallbladder. See, stone causes obstruction. So it causes the obstruction here as far as the gallbladder is concerned. So what happens is, the stones will come out of the gallbladder, and they are going to cause the obstruction of the common bile duct and prevents the flow of the bile into your duodenum. So as a result of that, there is development of jaundice, and this type of jaundice is called as obstructive jaundice. So your option here is obstructive jaundice. Okay. Next, physiological jaundice. So physiological jaundice, or it is the jaundice of the newborn. Okay. So the jaundice of the newborn. So this is seen in the newborn babies. Phototherapy can be given as a treatment. Both A and B are true. Neither A nor B is true. So you got 4 options here. So physiological jaundice, it is seen in the newborn children. Okay. And the treatment, because this happens because of sudden the liver is not properly developed for the conjugation of bilirubin. And the second thing is there is rapid destruction of the RBCs once the baby is born. So as a result of that, more amount of bilirubin will be produced, and the liver is not that properly developed to conjugate these bilirubin. As a result, the babies, like many of the babies, will develop this jaundice. This is called as physiological jaundice. Okay, so it disappears by about 14th or 15th day. And if it doesn't disappear and still there is yellowish discoloration, the bilirubin is more than about 12 or 15 milligram per deciliter. So it's in such conditions, so we need to give the phototherapy. Okay, so phototherapy units will be there. So there what happens, the bilirubin is converted into lumirubin. So it is converted into lumirubin. So lumirubin is water soluble and hence it is excreted. And follow up after this phototherapy, the babies better should be exposed to the early morning sunlight. Okay, right? So this is here the answer will be both A and B. That is, it is seen in the newborn babies, and phototherapy can be given as a treatment. So answer is both A and B are true. Option is C here. Next, pancreatic juice mainly contains. So pancreatic juice, it is a highly alkaline. It is highly alkaline. Gastric juice is highly acidic. Pancreatic juice is for neutralizing that acidity. As a result, it is highly alkaline. So alkalinity is provided by bicarbonate ions. So let's see the options. You got bicarbonate ions, calcium ions, chloride ions, and sodium ions. So here bicarbonate ions are the one which are providing the alkalinity to the pancreatic juice. So the option here is A. Next, coming to the 19th question. Which of the following has the highest pH? See, highest pH means the number is more. Okay, it may be around 8, 9, 10 like that. So highest pH means don't think like which is having more acidity. It is not like that. Which is having more pH means the number is more. When the number is more, it is basic in nature. It is basic in nature. Let's see the options. Gastric juice, bile in the gallbladder, pancreatic juice, and saliva. So here automatically the safe option is the pancreatic juice, which has got the highest alkalinity. So the option here is C. Next, Next, the glucose absorption from the gut occurs by, the answer has already come, that is the secondary active transport, but let's see how it happens. So the options given are simple diffusion, facilitated diffusion, primary active transport, and secondary active transport. See here what happens is the glucose is being absorbed from the gut with the help of sodium co-transporter. So here sodium co-transporter means, so automatically the energy it is coming from secondary active transport. Okay? So the energy for this transport is coming, the process is occurring by secondary active transport, not by the primary active transport. So here the option is D, that is secondary active transport. Next, Brunner's glands. So Brunner's glands, what they secrete? Enterogastrones, bicarbonate rich secretion, enzyme rich secretion, and potassium rich secretion. So here the answer is B, bicarbonate rich secretion, Brunner's glands. Next, coming to the 22nd question. Swallowing center, CNS is already finished by now. Even special senses is also finished. GIT is also finished. The swallowing center is present in cortex, midbrain, pons, and medulla. Okay. Definitely, swallowing center is present in the brain stem. Okay. So in general, you can tell the brain stem, but it is clear cut. It is present in the medulla oblongata. So the answer here is medulla oblongata. Next. 23 question. Iron is actively absorbed mainly in. So here be a little bit careful. Stomach, duodenum, jejunum, and ileum. So you have got 4 options here. Stomach, duodenum, jejunum, and ileum. So here the answer is ileum. Actually what happens is, in the stomach, this iron which is there, it binds to R protein and more than the intrinsic factor. Okay. And then what happens is, once this iron it is bound to the R protein, okay, and then it goes into your this one. Sorry, I was talking about the vitamin B12. So iron is absorbed in the duodenum. Iron is majorly absorbed in the duodenum. So here the option is duodenum. Next, coming to the 24th question. If the proportion of the dietary fiber or roughage is high in the diet, so what it is going to cause? So you might have seen in the clinical practice that whenever a person goes with the constipation to a doctor, so what he prescribes before medications, okay, certain dietary modifications are being prescribed. You are told to increase the water intake. You are told to increase fibers and roughage in the diet. The reason is, if you increase the fibers and roughage in the diet, so automatically what will happen is it is going to decrease the transit time. Okay, so let's see the options of transit time of the this one in the colon. So here you have got the options: decreases the stool transit time in the colon, decreases the food or chyme transmit time in the small intestine, increase the glycemic response to a carbohydrate meal, and increases the enterohepatic circulation of the bile. So dietary fibers and roughage, nothing to do with your bile, nothing to do here with your increased glycemic response to carbohydrate meal. So more of it is going to facilitate the easy defecation. It increases the weight of the stools. So as a result here, the best option is it is going to decrease the stool transit time in the colon. It prevents the constipation. It facilitates the easy passage of the stools. So here the answer is decreases the stool transit time in the colon. The A option is the correct answer. Next question, mass peristalsis. So mass peristalsis is nothing but it is going to help in the process of defecation. It is occurring in the terminal, this one, in the colon, right, terminal colon, and pushes all the feces matter into the rectum. So and finally it is going out through the anal canal. So let's see what are options. It occurs in the esophagus, stomach, small intestine, and the large intestine. So automatically very easy option to select, large intestine. Next, cholecystokinin pancreasamine is produced from G cells of gastric glands. It is not produced in the stomach. I cells of the small intestine, D cells of the pancreas, and hepatocytes of liver. Hepatocytes of liver won't produce cholecystokinin pancreasamine. D cells of pancreas, delta cells in glucagon, somatostatin, and then G cells of the gastric glands is not the answer. So I cells of the small intestine, this secretes this cholecystokinin pancreasamine. G cells secrete the gastric. So the option here is B, I cells of small intestine. Next, vitamin B12 is absorbed primarily. So I was confused with this vitamin B12 and iron. So here the correct answer is the ileum. Here what happens is this vitamin B12, it binds to the R protein, okay, in the stomach, and then when it enters into the intestine, so there what happens is this R protein is removed by the protease enzymes, and this vitamin B12 will bind to the intrinsic factor, and this complex which is there, so what happens is it moves down, and finally when it is into the ileum, so there it binds to the enterocytes, and when it binds to the enterocytes, the intrinsic factor is it remains outside this enterocytes, and the vitamin B12 it moves inside the enterocytes. So this happens in the ileum. Okay, so the answer here is vitamin B12 is absorbed primarily in ileum. It is ileum, right? But for the absorption of vitamin B12, you need intrinsic factor of calcium, which is secreted in the stomach. So don't get confused that vitamin B12 is absorbed in the stomach. Is it clear? Okay. So I am again telling you, vitamin B12 is first binding to the R protein in the stomach, then goes into the intestine, there it splits from the R protein, binds to the intrinsic factor, then comes to the ileum, there it is being absorbed. Intrinsic factor produced in the stomach, but absorption of vitamin B12 is occurring in the ileum only. And iron, it is the duodenum. Iron is duodenum, B12 is ileum. Next, going to the next question. Intrinsic factor is secreted in, just now we discussed about it, in stomach. So it has to be stomach. So here the option is C. Next question. The major mediator for the gastric acid secretion during cephalic phase is, so the options are histamine, gastrin, somatostatin and acetylcholine. So it is the parasympathetic activity. Is it clear? The neural control, parasympathetic activity. So parasympathetic, automatically it is going to secrete acetylcholine. So the option here has to be acetylcholine. The answer is acetylcholine here. Next, coming to the 30th question, vomiting. So very interesting question. Vomiting is not associated with the following event. Okay? So all of you, just like everybody would have experienced vomiting. So let's see what are the things, what are the options given here. Contraction of lower esophageal sphincter, deep breath, closure of the glottis, elevation of the soft palate. So elevation of the soft palate definitely occurs during the process of vomiting. Closure of the glottis also occurs to prevent the entry of the food into the respiratory tract. Deep breath is definitely taken. Now, if the contraction of lower esophageal sphincter occurs, how will the food from the stomach enter into the esophagus? Vomiting is nothing but emptying out of the contents which is present in your stomach through the esophagus, through the mouth into the external environment. So, if the lower esophageal sphincter is contracted, how will the food enter from the stomach into the esophagus? So, this is an option which is not going to happen in the process of vomiting. So, our question is, vomiting is not associated with the following event. Which event? So, the event is contraction of lower esophageal sphincter. So, the option here is A. Next, 31st question. All are pancreatic enzymes except for, so chymotrypsinogen, trypsinogen, amylase and ptyalin. Now here ptyalin, so ptyalin is nothing but salivary amylase. Now what has got salivary amylase to do in the pancreas? So salivary amylase is in the saliva. So here ready-made answer for you. The answer is D, that is ptyalin. Next question. The inhibition of the gastric juice secretion is brought about by, we are talking about inhibition, we are not talking about facilitation. So it is a histamine, cholecystokinin, acetylcholine and gastrin. So here gastrin facilitates, acetylcholine also is facilitating and histamine is also facilitating. So inhibition is brought about by cholecystokinin, which is being secreted from the small intestine. Next, coming to 33rd question. The parietal cells is stimulated by all of the following except for insulin, gastrin, stretch of the small wall, stomach wall and histamine. See here the question is parietal cells of the stomach. These are the parietal cells of the stomach. They are stimulated by the following except. See gastrin, it stimulates. Stretch of the stomach wall also stimulates. Histamine also stimulates. So the one odd one out here is the insulin. So insulin is the answer here. That is, it is not going to stimulate the parietal cells. So option is A. 34th, urinary bilirubin is absent in which type of jaundice? Hepatic jaundice, hemolytic jaundice, obstructive jaundice and fourth one is pre-hepatic jaundice. Now, for the urinary bilirubin to be excreted, the bile, it has to enter into the small intestine and from there it should be absorbed into your circulation and once it is absorbed into the circulation, so that goes to your kidneys and there what happens is this bilirubin is being excreted in the urine. So this will happen if the bile enters into your small intestine. Okay, and if it is prevented, the urine, bilirubin will be absent. So prevention is nothing but obstruction. So here the answer is obstructive jaundice. So in obstructive jaundice, automatically the bile is not entering into the small intestine, hence the systemic absorption is not there, hence again the excretion in the urine is not going to happen in this obstructive jaundice. Coming to the next question, which of the following is seen in obstructive jaundice? Excess of urobilinogen, excess of unconjugated serum bilirubin, excess of bile salts in the urine, and all of the above. So here the answer is C, excess of bile salts. Okay, so bile salts are excreted in the urine. Coming to the 36th question, the gastric phase of gastric juice secretion. The question here is gastric phase of the gastric juice secretion is brought about by neural factors, hormonal factors, gastric distension, and presence of proteins in the stomach. So here the question is the gastric phase of gastric juice secretion is brought about by which of the following? So one is the neural factors, second one is the hormonal factors, third is the gastric distension, fourth one is presence of proteins in the stomach. So all the things are there. I think there is one more option remaining here is E, all of the above. So I will choose all of the above here. So all the above four, okay, so they are bringing about this gastric juice secretion. Okay, so answer here is E. Coming to the next question, gastric emptying is decreased by all except. So here you have to choose the option which favors the gastric emptying. So fatty meal, hyperosmolarity in the duodenum, distension of the duodenum, and vagal stimulation. So here very easy this one, what option is there? So vagal stimulation is nothing but parasympathetic. So parasympathetic is nothing but acetylcholine. Acetylcholine is nothing but again increasing the GI motility and secretion. So that increases the GI motility and favors the gastric emptying. So the option here is the vagal stimulation. As far as other things are there, so they actually decrease the gastric emptying or they prolong the process of gastric emptying. So fatty meal, if more amount of fats is present in the meal, so the gastric emptying time is more when compared to that of proteins. And again, when proteins are there, the gastric emptying is more, the time is more compared to that of carbohydrates. So carbohydrates less time compared to proteins. Compared to proteins, this one, what the fat will take more amount of time for the emptying from the stomach. So the option is vagal stimulation. Coming to the 38th question, bulky, greasy, smelly, clay colored stools. So here the words are there, bulky, greasy, smelly, and clay colored stools usually indicate the failure of digestion. So here the indication is more towards the bile, fats. So the answer here is carbohydrates, fats, proteins, and peptones. Four options are given. So this condition is nothing but it is called as a steatorrhea. So steatorrhea, here there is problem with the digestion of the fats. Okay. So the option here is B. The answer here is B. Coming to the last question of today's class, obstructive jaundice is caused by defective pancreas, impacted gallstone in the common bile duct, liver deficiency, and when the bile is not removed from the blood. So it's a very easy question for you. So straightforward, you can easily go for the one which is causing the obstruction, that is the impacted gallstone in the common bile duct. So the option here is B. Okay. So that's all. These are all the there's an MCQs as far as JIT is concerned. So let's have a quick, very fast review of today's recap. I can say recap of today's class. Next, you have got the anatomy class. So be prepared for that. Okay. So the chief neurotransmitter of enteric nervous system here is the acetylcholine. Stimulation of the myenteric plexus causes all of the following except increased contraction of pyloric sphincter. Then the condition in which the lower esophageal sphincter fails to relax, it is the achalasia cardia. Factor inhibiting the gastric emptying is cholecystokinin. The factor that increases the gastric emptying is the gastrin secretion. The gastrocolic reflex is caused this one, what it is regulated by both neural and hormonal mechanisms. As the salivary secretion passes through the ducts, so there is addition of bicarbonate into the lumen. Then the chief cells of the stomach, okay, they are going to secrete pepsinogen. Parietal cells of the stomach, they secrete both HCl and intrinsic factor of Castle. Intrinsic factor is required for the absorption of vitamin B12, which is also called as extrinsic factor of Castle. Then cephalic phase of gastric secretion. So it is occurring before the food enters the stomach, accounts for 20% of gastric secretion also, and it occurs due to the sight, smell and the thought of the food. So all of the above is option here. Like the hormone responsible for gastric phase of the gastric secretion is gastrin secreting cholecystokinin and VIP. Answer is gastrin. Then sham feeding experiment proves the cephalic phase of gastric secretion is answer. Then the statement which is true regarding the prehepatic jaundice is, so here there is increase in the concentration of unconjugated bilirubin in the blood is answer. Excessive breakdown of RBCs leads to prehepatic jaundice. Then stones in the gallbladder leads to obstructive jaundice. Physiological jaundice is seen in the newborns and it is treated with phototherapy. So both these options are correct. Hence here the C option is correct answer for this question. Then pancreatic juice mainly contains bicarbonate ions. That is answer. Then which of the following has highest pH? Highest means more number. So more number means alkalinity. It is the pancreatic juice. Then the glucose absorption from the gut, it occurs by secondary active transport. So it is glucose is absorbed by the sodium co-transporter. So it is secondary active transport. Then Brunner's glands. So this secretes the bicarbonate secretions. Swallowing center is present in the medulla. Then iron is actually absorbed mainly in the duodenum. And if the proportion of the dietary fiber is increased, so what it does is it prevents the constipation. It decreases the stool transit time in the colon and hence it prevents the constipation and facilitates easy passage of stools. Next, mass peristalsis is seen definitely in large intestine. Then cholecystokinin, pancreasamine is produced from the eye cells of the small intestine. Vitamin B12 is absorbed from the terminal ileum. Intrinsic factor is secreted in the stomach. Then the major mediator for the gastric acid secretion during the cephalic phase is acetylcholine. Vomiting is not associated with the closure or the contraction of the lower esophageal sphincter. That is option correct here. And all are pancreatic enzymes except for ptyalin, which is also called salivary amylase. The inhibition of the gastric juice secretion is brought about by cholecystokinin. Parietal cell is stimulated by all of the following except insulin is option here. Urinary bilirubin is absent in obstructive jaundice. And which of the following is seen in obstructive jaundice? So you get excess of bile salts in the urine. Then the gastric phase of gastric juice secretion is brought about by the presence of proteins in stomach, gastric distension, hormonal factors, neural factors. So all are there. So all these are being covered by the fifth option, that is all of the above. Then gastric emptying is decreased by all except for. So vagal stimulation causes release of acetylcholine. Acetylcholine favors gastric emptying. So this is the option here. And bulky, greasy, smelly, chelated stools indicates failure of digestion of fats. It is steatorrhea. This is steatorrhea. So it indicates the failure of digestion of fats. Next is obstructive jaundice is caused by impaction or impacted gallstones in the common bile. So that's all for today's MCQ class of the GIT. I hope you people were there with me throughout this class, and please go through with these questions and try to make yourself perfect with the questions which were discussed in today's class, as it may help you very much in your internal assessment exam and annual examinations. So don't neglect it. Please concentrate properly. And MCQs are always scoring questions. So never neglect them. Concentrate on them. Please read every word of the question. Read all the options available. Then only you answer the question. So don't just get excited by seeing a particular word in a question and immediately go and tick a particular answer in the options given. Read every word of the question. Read all the options available in the answer. Then only you go for the correct answer. So that's all for today's class. Thanks for being with me. So have a wonderful day. So stay home, stay healthy, take care.